Yes, my name is Les Wilson. I was recently had surgery here at MUSC. Dr. George was my surgeon. My surgery was to originally remove a fistula. However, after they got in during the surgery, found that I had a little more extensive damage than what was originally thought. And when I woke up, I was a little bit lighter because I had 18 inches of colon that had been removed. I would like to express my sincere thanks to the staff, not only the doctors but the nurses that attended to me as well. The experience was, number one, a little bit scary in the beginning because I was going to be on my own doing this. With COVID-19 being in place, it made it sort of difficult for me to have visitors and have others involved outside of the staff in my treatment. Regardless of that, the staff was excellent at making me feel comfortable. The communication with me as well as with my family and letting them know throughout the process what was going on, and then post-operative what the results were. Once they got me up onto the floor, the nurses and the doctors took great care of me. Still a little bit nerve-wracking because I was on my own and I was going to be in the hospital for several days. However, I will say that it was quite enjoyable from a standpoint of whenever the doctors or the nurses came in to explain anything to me, they allowed me to call my wife, put her on speakerphone, and so she was involved every step of the way with my treatment and understanding what was going on, what was next, what was to be expected, and that was just excellent for me. The nurses were and the techs were very encouraging. They encouraged me to get up, to move around, to do the things that I needed to do in order to recover as quickly as possible. I'm happy to say that pre-op, I walked 5 miles a day just as a standard procedure, which sort of helped me be ahead of the curve a little bit. And post-procedure, 2.5 weeks later, I am back up to 3 miles a day at the speeds in which I was at pre-operative, and I think that was here again as a result of the fact that I had done the things that the staff had asked me to do to leading up to the surgery. The experience overall, though it was needless to say an inconvenience, was still very, very positive, and I appreciated everybody's efforts that was involved in my recovery and continue to be to this day. Thank you to the staff, thank you to everyone involved, and then of course to my wife for being very patient with me since I've been home.